Hi, this is Dr. Reynaldo Joson, Director of ROJoson PEP TALK. I have a patient empowerment program which I like to empower the lay people or patients to take control in the management of their health. What I have in mind in my PEP talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. That is my key performance indicator. I hope you'll be in my group of 30. I launched this pep talk on May 15, 2021 with module on COVID-19. Second module, patient empowerment. Third module, patient management process. Fourth module, rights in patient empowerment. And this is the fifth module, staying healthy and contented. The fifth module has 5 parts: introduction and intentional living plan, healthy lifestyle plan, screening and periodic health check, early diagnosis and treatment, first aid, and basic medical care. My pep talk today is entitled First Aid and Basic Medical Care. The empowerment objective is for the lay people to have an understanding of first aid and basic medical care as parts of a patient empowerment program. One tactic to stay healthy or alive and not crippled as long as possible is to know how to do first aid and basic medical care for common medical emergencies. Common medical emergencies, if not properly and timely treated with first aid and basic medical care, may lead to disability and even death. So a person who aims to stay healthy or alive and not crippled as long as possible must know how to do first aid and basic medical care for common medical emergencies, especially those which are life and limb threatening. First aid is the first and immediate emergency care provided for injury or illness with the following criteria: done immediately after it occurs, done at the location where it occurred, often consists of one-time short-term treatment, requires little technology or training to administer. The 3 P's of first aid consists of the following: preserve life, prevent further injury, and promote recovery. Basic medical care means care essential to maintain the health and safety needs of a person with goals to preserve life, to prevent the health condition from worsening, and to promote recovery. First aid and basic medical care can be used synonymously. First aid is a more popular lay people term than basic medical care. Basic medical care is more encompassing than first aid. What will be included in this pep talk are even those common emergencies, medical emergencies, which cannot be managed by a person himself because of loss of consciousness. Examples are cardiopulmonary arrest and fainting. Having knowledge of the first aid and basic medical care of the common medical emergencies in which a person will not be able to manage himself because of unconsciousness may still be helpful in staying alive and not crippled. He may and should be empowered to teach other people on what to do during medical emergencies. Teaching other people, especially those who are always around him, may save his life and limb when the people he has taught apply their know-how on him when the need arises. Or before he completely becomes unconscious, he may coach them on what to do to save his life and limb. Also, what will be included in this pep talk are what I think are the more common ones based on my experience. I may not be able to include all possible medical emergencies in the world, but rest assured that I will refine my pep talk in terms of addition and even subtraction so as I go along with my patient empowerment program. Below are the medical emergencies that will be expounded in this pep talk: cardiopulmonary arrest, airway patency promotion, management of choking, fainting, splinting of fractures, and bleeding in body surface wounds. I will just present the essential elements in its medical emergency. For details, please look up the internet. There are a lot of write-ups and videos on this. Cardiopulmonary arrest. Cardiopulmonary arrest is the cessation of heartbeat, cardio, and respiration pulmonary. Recognition includes the following: loss of consciousness, absence of breathing effort, and absence of pulse. Diagnosis as to the cause. There are many possible causes, but primarily the causes are on the heart and lungs diseases, and others are secondary affectation of the heart and lungs. The cause may not be evident at the time of the arrest, or the cause may be evident or assumed in those with known medical disease prior to the arrest. The first aid and basic medical care for cardiopulmonary arrest is essentially cardiopulmonary resuscitation. But do this only when there is no advance directive on no CPR, because patients who are terminally ill may have an advanced healthcare directive of no more CPR when they develop cardiopulmonary arrest. The emergency life-saving actions include the following: clearing the airway, upper airway, repeated chest compressions, and repeated mouth-to-mouth breathing. Note there's a version now of CPR that does not require mouth-to-mouth resuscitation anymore. The processes in the cardiopulmonary resuscitation, or in the first aid and basic medical care for cardiopulmonary arrest, consists of the following: recognition of the cardiopulmonary arrest. So ask someone to call 911, 143, 117, or any hotlines of a nearby hospital with an ambulance. And then institute cardiopulmonary resuscitation. First, clear the upper airway to ensure patency. Then do chest compression. With hands-only CPR, we only do chest compression. So push down hard and fast in the center of the chest at the rate of 100 to 120 pushes a minute. When they say push down, you push down hard by about 2 inches. Let the chest come back up to its normal position after each push. In the conventional CPR, there is a mouth-to-mouth resuscitation in which the ratio of the chest compression to the rescue breath is 30:2. So this mouth-to-mouth breathing is not done in hands-only CPR. The emergency life-saving actions in the cardiopulmonary resuscitation are done until the person in cardiopulmonary arrest has been revived or has started breathing on his own, or are called off because of a judgment of non-reversal already. We now go to airway patency promotion. Airway patency promotion refers to ensuring that the upper airway is not obstructed. The upper airway extends from the mouth to the trachea. It has an important role in transporting air to the lungs. Every person needs air to breathe and oxygen to survive. Obstructed upper airway can cause death. In all cases of medical emergency where first aid is needed, ensuring airway patency is the top priority. The A in all the popular emergency algorithms like ABC and ABCDE stands for airway. Promoting airway patency stands first before the B or breathing and C or circulation. First aid and basic medical care consists of the following. Check first whether the patient is breathing naturally or not. If not, check the face, mouth, and neck for anything that will make one suspect something is mechanically obstructing the upper airway. If yes, try to remedy the obstruction such as by releasing something that strangles the neck and removing or clearing objects in the mouth that is impeding airflow into the lungs. If there is no object that is mechanically obstructing the upper airway, especially in unconscious patients, to prevent the relaxed tongue from falling back to obstruct the airway, one can do the head tilt chin lift maneuver or the jaw thrust maneuver. In the head tilt chin lift maneuver, one hand is applied downward with downward pressure to the patient's forehead. And then the tips of the index, at the same time, the tips of the index and the middle fingers of the second hand lift the mandible at the chin, which lift the tongue from the posterior pharynx or throat. In the jaw thrust maneuver, hands are placed on each side of the face with fingertips at the angle of the jaw or mandible, and then gently lifting the jaw to open the airway. One has to remember this, a jaw thrust and not the head tilt chin lift is done in patients with possible spinal injury on the neck. Choking. Let's now go to choking. Management of choking. Choking occurs when a foreign object lodges in the throat or windpipe, blocking flow of air. In adults, a piece of food often is the culprit. In young children, swallowed small objects is often the culprit. Because choking cuts off oxygen to the brain, so one must give the first aid as quickly as possible. The universal sign of choking is hands clasped to the throat. Other early signs are inability to talk, difficulty breathing, and noisy breathing, squeaky sounds when trying to breathe, cough which may either be weak or forceful. If a person is able to cough forcefully, the person should keep on coughing. If he cannot, the following can be tried: abdominal thrust or the Heimlich maneuver and back blows. For the Heimlich maneuver, this is for those which will be performed on someone else with choking situation. Stand behind the person, wrap your arms around the waist, tip the person back forward slightly, make a fist with one hand, position it slightly above the person's navel, grasp the fist with the other hand, press hard into the abdomen with a quick and upward thrust as if trying to lift the person up. Perform the abdominal thrust until the blockade is dislodged. To perform abdominal thrust or Heimlich maneuver on oneself or yourself, place a fist slightly above your navel, grasp your fist with the other hand. Shove your fist inward and upward. Or stand against a countertop, desk, or a sturdy chair. Press your upper belly firmly against its upper edge, grasping its sides with both hands. Thrust yourself forward vigorously, bending slightly at the waist. Repeat as needed. For the back blows, the maneuver is such that is done in the following method. Stand to the side and just behind the choking adult. For a child, kneel down behind. Place one arm across the person's chest to support. Bend the person over the waist so that the upper body is parallel to the ground. Deliver separate back blows between the person's shoulder blades with the heel of your hand until the blockade is dislodged. We now go to fainting. What is fainting? Fainting happens when you lose consciousness for a short amount of time because your brain isn't getting enough oxygen. The medical term for fainting is syncope, but it's more commonly known as passing out. A fainting spell generally lasts from a few seconds to a few minutes. As to recognition and diagnosis, sudden loss of consciousness for a few seconds or minutes, followed by full return to full consciousness and functionality. Most fainting have no serious health consequences, as these are being caused by transient factors such as emotional shock, sight of blood, lack of food, dehydration, exhaustion, standing up suddenly, etc. If you feel faint, lie down or sit down. To reduce the chance of fainting again, don't get up too quickly. Place your head between your knees if you have to sit down. If someone else faints, position the person on his or her back. If there are no injuries and the person is breathing, raise the person's legs above the heart level, about 12 inches or 1 foot. Loosen the belt, collars, and other constrictive clothings. To reduce the chance of fainting again, don't get the person up too quickly. If the person doesn't regain consciousness within 1 minute, there may be a serious underlying cause and should be managed accordingly. Check for breathing. If the person is not breathing, begin cardiopulmonary resuscitation. If the person was injured in a fall associated with a faint, treat the bumps, bruises, or cuts appropriately. Control bleeding with direct pressure. We now go to splinting of fracture. What are fractures? Fractures are broken bone. Any bone in the body can be fractured either by trauma or by disease. As to recognition and diagnosis of fractures, the signs and symptoms, or the symptoms and signs of a fracture vary according to which bone is affected, as well as the type or severity of the fracture. Obvious or overt signs are angulation of the bony area and protrusion of broken bones through the skin. Covert or inconspicuous symptoms and signs are extreme pain and tenderness, with the patient being not able to move the affected part. The most important thing to remember is never to move a patient with a suspected fracture. This may cause severe pain and may worsen the injury. Assess the patient rapidly for type and severity of fracture. Also check for the inability to move the injured area or any sign of bleeding. When there is bleeding, Apply pressure on the wound to prevent excessive blood loss. Immobilize the affected part with splints. Apply cold compress on the affected part, and then wait for professional help to arrive. Splinting is immobilization with any device, any sturdy objects like woods and sandbags. Check the distal pulse and skin color before and after splinting of fractures in the extremities. For fractures in the neck or spine, immobilize the neck such as using sandbags or hard pillows. For fractures in the extremities, incorporate joint above and below the fractures in the splint. For fractures in the forearm and hand, an arm sling with a triangular bandage can be used. Now to the last topic, common emergencies, bleeding in body surface wound. Body surface wounds are any breaks or disruption of the skin up to the fatty and muscle layers, and not including bones and internal organs. Body surface wounds can occur from head to toe. Trauma is the cause of the wounds. There are different types of wounds depending on the cause and severity of the force or trauma. The body surface wounds may be mild, moderate, or severe. It's mild when the wound is small and very superficial. Severe when it's large and deep. Moderate, in between, mild, and severe. At the first sight of a wound, check for bleeding and rate of bleeding. If profuse, apply direct pressure right away. If not, wash the wound right away with water and keep it clean with a bandage. Determine whether there is a need to seek medical professional help, such as need for suturing, need for anti-tetanus injection, etc. And determine whether there's a need for medications. So there you are. I have presented the following 6 medical emergencies in this PEP talk. Cardiopulmonary arrest, airway patency promotion, management of choking, fainting, splinting of fractures, and bleeding in body surface wounds. As I said, I just presented the essential elements in each medical emergency. For details, please look up the internet, as there are a lot of write-ups and videos on this. Takeaway in this PEP talk as they relate to patient empowerment. Know how to do first aid and basic medical care for these 6 common medical emergencies as a tactic for you to stay healthy or alive and not crippled as long as possible. For you to make you become more patient empowered. Maximize your knowledge, kaalaman. Maximize your capability, kakayanan. And lastly, maximize your self-determination, kapangyarihan in mastering and learning more medical emergencies, as this will redound to gaining greater control over decisions and actions on your health, which is the ultimate goal of patient empowerment. With this, I end my PEP talk. Staying healthy and contented, first aid and basic medical care. I hope I have empowered you to have a better understanding of the first aid and basic medical care as parts of a patient empowerment program. Thank you for your kind attention. Good day. Mabuhay kayong lahat.